today. I didn't get to hear all of Dr. Chase's because I had a Zoom conference that I was in charge of this morning. So I look forward to meeting you, the people who I haven't met yet this afternoon. Well, before I even say that, I was just thinking when Christy was presenting about the neuroregenics and how it bypasses the liver. And we'll kind of talk about that, but it's what's always amazing to me is how standard process and MediHerb, there's intelligence built into the products, right? So we don't even have to think about it, but when it's bypassing the liver, right, you're bypassing, if you have a patient that has systemic inflammation and neuroinflammation, the liver's already not functioning super adequately, right? So we've got something in it that's helping tonify the liver, but yet we don't rely on the liver for the function of the product. And that's something we don't even have to think of. It's already built into the product ahead of time, which is just amazing to me. So kudos to the standard process brain trust that's figuring this stuff out. So I don't even know if this is the accurate title for what I'm talking about today, because it's such a big topic. I found myself like, okay, where do we stop? Where do we begin? So I'm trying to bring up some sort of biochemistry, neurobiology information, but then also make it practical. Because at the end of the day, right, if we can't take this information and use it in our practice, it's sort of meaningless, right? So hopefully we'll see this will move forward, but maybe not. It should. Maybe it's not doing it because, well, Chase, maybe we should try. Oh, well, he's okay.
I can click.
All right, you want to just push it forward. It should move. Is it working? No. All right, let's technical. Why is it not? There we go. Okay, so it's just going to be. I can do this up here. Okay, perfect. All right. There we go. Okay, so just a little bit about trauma first. First of all, the word kind of gets abused sometimes, I think. But if we just go back to, trauma's been something that's been looked at long before even 1941, so I won't go back into that. But Abram Gardner wrote a book in 1941 called The Traumatic Neuroses of War. And basically that was sort of a foundational work that later kind of delved into what we currently call PTSD. And so what he studied was World War I veterans coming back from war and the effects that they saw on these veterans. And in his work, he described the nucleus of the neurosis that he saw in these traumatized World War I veterans. He described it as a physioneurosis in 1941. Right? Physioneurosis meaning it's a whole body neurosis, not a brain neurosis. Now, somehow between 1941 and current, we sort of coned down trauma in some circles. Now it's kind of coming back the other way to where it was just a brain dysfunction. And we can talk about the reasons for that. I think one of those reasons is the pharmaceutical industry, because if it's just a brain problem, then we can just take a brain pill and fix it, right? So, but there's a lot of other reasons too. Probably lack of holistic kind of understanding in our society and that kind of thing. So, but in other words, post-traumatic stress isn't all in one's head as some people suppose, but has a physiologic basis. And he realized that symptoms have their origins in the entire body, in response to an original trauma. And so another quote from his book was, sufferers from traumatic neuroses develop a chronic vigilance for and sensitivity to threat. So that's one of the big differences between what we determine to be trauma and just eustress or healthy stress, is that we maintain this chronic vigilance over time. So hopefully this is going to work. Well, maybe not. Gosh. There we go. It's okay. I got it. So when we're practicing, I'm assuming we've got acupuncturists, right? We've got nutritionists, we've got chiropractors, any MDs? I might be missing. Am I missing any practitioners? Does that cover everybody? Okay. So when we're working with patients, oh, there we go. Oh, thank you. Okay, which one's the forward? To the right. Okay, thank you, Chase. He's a much more savvy technical guy than I am. So when working with patients, right, I think we just want to widen our view and or our bias about trauma. And the question is, can we remove, when we're working with a patient, can we remove our own judgment about what our patient defines as trauma for themselves to be more helpful? And I put in parentheses, deeply understand and connect with the patient's story. So one of the things that I learned in my IFM certification, which kind of happened over 2 or 3 years, was that one of the biggest things they talked about in that whole certification was when you're taking an intake of a patient, can you repeat the patient's story back to them in their own words? Not in your interpretation of their story, but their actual story. And so I put DIV here so this is kind of my realization of this was, and I remember this being in practice. I've been in practice now 25, 26 years. I went through a divorce after 25 years of marriage. And I remember prior to that time, having patients come in and talking about the traumatic experience of going through a divorce and the loss of a relationship. And I remember thinking when people would come in, kind of like, well, yeah, that's probably difficult, but there's definitely worse things that can happen, and kind of almost minimizing it because I didn't fully understand what that was like, right? Until I actually went through it. So really trying to connect with a patient's story and look at if we have judgments about the particular trauma that's walking into our office. The abused child who tries to make sense of what they did and how they participated in an abusive dynamic to survive as a child. So it's not only just the trauma when we're talking about children or adults, but in this case, children, it's not just the trauma that the person experiences, but it's also the trauma of how they had to participate in that experience. And some would say, and in The Body Keeps the Score, which is a book that, there's some, depending on what part of the professional world you're in, some people thought it was foundational and other people thought it was a crock of crap. But there's some very interesting statistical information and practical information that would say that sometimes the most traumatic part of the trauma is how that person had to participate, not the actual trauma itself. So very interesting stuff. I won't go into the example. Well, actually, I will. This particular veteran that was mentioned in The Body Keeps the Score, his name was Tom. He was a Vietnam veteran. He actually witnessed his whole platoon killed in front of him, and whatever day it was, and that happened. His best friend was killed right next to him, but his whole platoon, he was the only survivor. I think there were 17 people or 18 people. And he had a traumatic vision of seeing his friend's body face down with the feet up and the head in not such a great condition. The day following, he actually went into a small village where he was in Vietnam and actually killed children, killed a couple of children, killed a farmer, and then brutally raped his wife. And so the author of The Body Keeps the Score was actually working with that patient, and the most difficult thing to overcome for Tom was actually the trauma that he created in victimizing those people as a result of the PTSD that he had suffered. So, and I know some of this stuff is a little bit heavier, so we'll kind of put the heavy stuff at the front, and then we'll get to the other stuff at the end. So, Kaiser Permanente, if you ever talk to any doctors from California, they will be like, I hate Kaiser. But they did a study back in 95 to 97. There were 17,000 adults that were in the study, and they did confidential surveys regarding childhood experiences. Let's see. Okay, there we go. So this was the results of the study, and I'll just let you look at those statistics. But this is in 1995 to 97. So we're what, like 27 years down the road? I will guarantee that these statistics aren't better now. So this is some pretty tough stuff to look at as far as statistical analysis from that particular study, which was 17,000 people. It wasn't like they did 100 people or 50 people. This is Bessel van der Kolk's book, The Body Keeps the Score. It was written in 2014. He talked about traumatized, in almost all situations of addiction. He wasn't willing to say all, but almost all situations of addiction, they are inextricably related to trauma and neuroinflammation. So when you see patients in your office that have either an addiction history or are currently in an addictive pattern, we know that we can almost be assured that there is trauma involved somewhere underneath that. So 1/3 of couples engage in violence at some point in their relationship. 1 out of 8 children witness physical violence between parents. Trauma specifically, and when I say trauma here, we'll talk about kind of expanding the view, but trauma and chronic stress are highly correlated. So even though they're different things, right? A traumatic event and chronic ongoing stress aren't exactly the same thing. Sometimes they can kind of share a similar piece, but they're not always the same thing. But in fact, what they do with regard to neuroinflammation is very similar. So patients, when you're taking a patient's history and you hear somebody say, like, I just can't, and I'll talk about it in a case study later, where they talk about the fact that they're just not able to really engage in relationships, whether it be intimate relationships most commonly, or friendships or work relationships. We always want to think about trauma being underlying that. So we talked about 5 already. 12 million women in the US have been victims of rape. This was in 2014. So those statistics, I'm sure, have not improved. 3 million children are victims of abuse or neglect that are reported. Those are reportable, and 1 million of those cases are deemed credible every year in the US to where they're actually investigated. Trauma and stress are different, but both cause neuroinflammation. The difference being with stress, acute stress is actually less neuroinflammative than chronic stress is. So an acute stressor, right, it's limited and it's finite, right? It has a peak to it and then it ends. Where we get into challenges with neuroinflammation is your chronic stress, which is oftentimes unlimited, or there's no known end to it, and it's ongoing, and it doesn't even have to be actually as high a peak of stress. The stress itself can be lower, but it still has a damaging physiologic effect. And there is also eustress. I put eustress there, meaning there is stress that's good too. So it's not all stress is bad. They looked at studies with children, and this is something interesting to think about because it would also apply to adults. When we have children and adults that are surrounded by a supportive, responsive group around, so a mom and dad with a child, or siblings, or an adult that is part of community, part of a spiritual community, has support, the effects of trauma and the related trauma response is significantly reduced. So, and then you guys probably somewhere along your education have heard of Hans Selye and the stress adaptation theory. So that's the idea that a certain amount of stress actually helps the body develop, whether it's training stress, life stress, any kind of stress that affects the body. A certain amount of that actually helps us develop in a healthy and effective way. And it's only a problem when the ability of the body to adapt to the stress is overcome, that we get out of balance, homeostasis balance, and then we get dysfunction that starts to occur. I put a bunch of books over here that are all really good reads, and I'll have the reading list at the end too, but you're welcome to look at those books up there on the counter. When I first saw this picture, for whatever reason, and I do not have a abuse history, thankfully. I have not had to deal with that in my history, but this picture, when I saw this picture, it just hit me. It was so profound in what it says. And, it starts here with a little boy and it comes back around, right? And it's a cycle. And this is just one of the trauma cycles that we see. This has to do with physical abuse, but there's mental, emotional, sexual, all different kinds of trauma cycles that we experience. So, and you're seeing these, obviously you're seeing these in your office as well. I think Chase also you had this slide too, right? Yeah, this is a great slide, and it talks about the differences between healthy, if there was such a thing as neuroinflammation or true helpful neuroinflammation, and then actually the negative aspects. This particular slide really kind of explains the difference between the two things. So on the left side, you've got the transient low inflammation that actually reorganizes the priorities in the brain, helps with executive functioning. You have development and memory that are actually stimulated with a certain amount of neuroinflammation as we're learning. I did see one study that was trying to promote, which I don't know, I guess everybody has a different thing, was trying to promote that using iPads would actually create a low level of neuroinflammation, which could be a beneficial learning tool. There were a couple studies, you can find them on PubMed. I'm not going to jump in and support that, but that is out there. That right, yes, right. And this is the thing too, which is different than when I was talking to John. He's been practicing 12 years longer than I have, but somehow I've become one of the older people practicing, and I remember not too long ago I was the new person starting. PubMed used to be, when you would go on PubMed or you would go on some of these research sites and you looked up a research article, you could be sure that it was, relatively speaking, unbiased back in the day. Unfortunately now when you go on and look at a lot of these studies, they are somewhat bought and paid for. So it's just a kind of unfortunate where we are these days. So always look at who's funding your studies. This is injury remodeling here. Interleukin-4 is heavily involved in it. That's an anti-inflammatory cytokine. So you can see interleukin-1, interleukin-4. They're actually upregulated to reduce inflammation over time. And then you've got immune system preconditioning, which is actually very helpful. And you can see down there it says euflammation, which I don't think is actually a word, just like neuroinflammation is not a word. And then you've got over here the negative aspects of neuroinflammation. And again, the difference between these two sides is typically two things: duration and intensity. That's what determines whether you're on the left or the right side of this chart. This is the stress-induced inflammatory response, and I'm not going to go into this. Chase and I were talking about this, like going into DAMPs and MAMPs and toll-like receptors, and it can make your head spin, and actually it's not really super helpful for what you're going to do in your practice. But you can see this starts here with a stressor, a psychosocial stressor of some kind, which can be anything from isolation to trauma to chronic emotional stress. Creates catecholamine production, which is released and then activates the sympathetic nervous system. And you guys, if you remember from either chiropractic college or back in the day studying neurology, that's activation of mainly a lot of your splanchnic nerves, which are from about I think they're T5 to T12, which kind of modulate the sympathetic nervous system. So that then stimulates bone marrow production and your myeloid cells, which come from bone marrow. What's interesting, which again is built into neuroregenics, is that those myeloid cells are actually and it's what the thymus, right, takes the myeloid cells and makes T lymphocytes from immature lymphocytes. So it's already built in there, right? We've got this, not that it's not in neuroregenics, but it's already built into thymus PMG, right? That we've already got this, and we'll see the study that Standard Process did on thymus, thymex, thymus PMG, and then glandular thymus points to this. So we go from step 1 and we move around to step 2, which is then we get this inflammatory signaling pathway, and you get activation of NF-kappa B, which stimulates the release of other pro-inflammatory cytokines. So this is tumor necrosis factor. It's actually the alpha version, which they didn't put in there. Interleukin 6, interleukin 1B, and 18, those can all access the brain. And so then we get this kind of neuroinflammation system starting, and then you go up to number 3 there, which you also get activation of the microglia, which is the main thing we're dealing with, is this activation of microglia that doesn't get calmed down. So this was a meta-analysis in 2016 by Baumeister, et cetera. I won't go into all the other, there were a host of authors, but what they found in their findings were there was significant association between childhood trauma and inflammatory markers with the greatest effect on tumor necrosis factor alpha, interleukin 6, and C-reactive protein. What was interesting is that physical and sexual abuse seemed to increase TNF-alpha and interleukin 6, but not C-reactive protein, whereas more absence of a parent or parental neglect seemed to correlate more with C-reactive proteins. So think about this in your practice, right? If you're seeing a chronically high C-reactive protein, right, we just kind of go, okay, well, there's some inflammation, maybe some increased cardiovascular inflammation, but now we've got another thing to think about when we think about trauma and history. So if we also have a patient that in their history, there's a family history of neglect or absent parenting, there's a correlation. So they also found that modifications of the hypothalamus pituitary axis and neuroplasticity were related to methylation, increased methylation patterns of the glucocorticoid receptors. Specifically, this one gene gets switched off, which is extremely crucial in regulating inflammation. So the glucocorticoid receptors activity is reduced, which then leads to an increased inflammatory. So it's basically not, it's not controlling inflammation. And then you get this cycle where we're not controlling inflammation, inflammation gets higher, we're not controlling inflammation, and the cycle kind of goes that way. They also found that exercise, moderate and aerobic, that's the key with exercise, which we'll talk about later, is moderate and aerobic. So high intensity, workouts at Orange Theory are probably not going to help in this situation. So we're talking things like light swimming, jogging, walking, yoga, gentle Pilates. There's a lot of choices. If I didn't hit your one, but it's basically, it has to be moderate and aerobic. That's the key. That increases vagal tone, which in turn decreases systemic inflammation. We also know that exercise changes the composition of the gut microbiome towards a less inflamed state. And we'll talk about that when we talk about the gut-brain connection. Let's see. Okay, this is, we'll talk about 4 later, but I'll just let you read that for a second there. That's kind of interesting. Acute low-level neuroinflammation is normal and protective. So when we think about neuroinflammation, don't just think, oh, all neuroinflammation's bad. There's actually good neuroinflammation that's protective and actually helps with development of protective for the nervous system, brain development, helps with fixing cellular repair, toxins, pathogens, viruses, bacterias, fungal overgrowth, all that kind of stuff. We talked about the microglial cells, and I think probably Chase mentioned this too. They are activated in the presence of pathogens, tissue damage and injury, and toxins, and they induce pro-inflammatory mediators. That's what they're supposed to do. That's normal. It's when we get to chronic neuroinflammation that the things become problematic. That's where the inflammatory mediators increase infiltration of the active immune cells into the brain, so you get a disrupted blood-brain barrier. And then your myelin, your white matter, your neurons, your axons, and blood vessels are all targeted. Reduced expression of neurotrophins, which you talked about with the BDNF. So we get BDNF and nerve growth factor are actually reduced. So we have less of the things that actually help heal the brain. The concentration of those actually goes down. This was a specific study on neuroinflammation in post-traumatic stress disorder. So this is, again, this was specific to post-traumatic stress disorder, but remember, chronic stress functions heavily like post-traumatic stress disorder. So I just want you to keep that in mind, because we're going to see more chronic, unrelenting stress in our offices, and we are a true PTSD situation. But what they found was all these cytokines were all upregulated. And in PTSD, what's interesting is there was an upregulation of the cytokines prior to the trauma, and there was an increase in the cytokines after trauma. So basically, what I'm wanting you to think about is we're helping patients with neurogenics and some of these products. We're helping people to avoid the damaging effects of trauma that might happen after we're working with them, and also helping with people who have experienced trauma, because it's high. People who are predisposed to a long post-traumatic syndrome actually have higher levels of these cytokines already, which is really, really interesting. Pre-existing high C-reactive protein is correlated with the occurrence and severity of PTSD. So I have thought heavily about, I didn't, with every patient, always run a CRP. I'm almost thinking now that I would, just because of this additional information outside of just typically running it for inflammation that we see systemically and cardiovascularly. So let's see what else here. I'm trying to make sure I want to make sure I need to finish by noon, right? Yeah.
Yeah.
Okay. Yeah. Okay. No, that's good. Okay, neuroinflammation occurs, we talked about that, when nerve cells are continuously and chronically activated. And the pro-inflammatory cytokines affect cognitive, functional, and morphological aspects of brain. So the actual functional part of the brain, but also the actual physical part of the brain is also affected, which affects neuroplasticity and memory. I think that's what we'll cover there. Let's see. So this particular study, it was a rat study. And in this particular study, as opposed to the thymus study that Standard Process did, where they did a cortical brain impact with a hammer or something, like, I don't know what they used, but they did a cortical brain impact on the brain itself, which is more of a physical inflammatory stressor. This is where rats were placed under social stress situations. So they were either isolated or kept from the rest of the group, or other stressful environments were placed on them. And they found that the corticosteroid levels went significantly high, kind of similar to what you would see with the adrenal cortex in a human, right? We have cortisol, they have corticosteroid. And they noticed that HPA axis dysfunction was noted when the corticosteroid was inhibited, meaning at some point the cortisol gets inhibited in a human, and then there's no ability to, because initially, remember, cortisol is not, we think of it typically as an inflammatory substance, but it also helps control inflammation. So there's a balance of cortisol that we need, and the HPA axis starts to be affected negatively when cortisol is not controlling inflammation adequately. And then you usually see that in if you know the cortisol adaptation curve, you see that at the end when the cortisol level just decreases and it can't adapt anymore. So again, chronic stress. Don't think acute stressors. Okay, this is a mouthful here, but you can read this. Stressors activate the HPA axis, which we know, through stimulation of the sympathetic nerves and the autonomic nervous system. Epinephrine and norepinephrine are released and activated by the splanchnic nerves, which we talked about, that are in the thoracic spine, and that's how the sympathetic nervous system is activated. The hypothalamus is also activated, and it promotes secretion of corticotrophin-releasing hormone, which stimulates the sympathetic nervous system and produces catecholamines, what this, I guess the synopsis of this particular slide is that stressors highly activate the sympathetic nervous system and the hypothalamus. And if that is chronic and long-standing, or in an acute situation with an extremely traumatic happening, where that level and intensity is so high, that's where neuroinflammation starts to happen. So, and the summary of it is impairment of the HPA axis due to PTSD can lead to neuroinflammation. And remember too, when we're talking about the brain, right, with brain development, we've got the brain stem, which is amygdala, and some projection to the hypothalamus. Then above that, we've got the midbrain. Then above that, we've got the neocortex, and then we've got the cortex, right? So the most primitive part of the brain is the amygdala and the hypothalamus connection, and that's where things like NET, emotion code, acupuncture, full body, energetic, emotional techniques that connect body with subconscious tend to shine. EMDR, there's so many. Splanchnic therapy or Splanka therapy. I just heard of this from one of my patients. I didn't even know what that was. So, so anyway, conclusion of this one, one of many, is that cytokines acting on the central nervous system through endothelial cells of the blood-brain barrier contribute to neuroinflammation. In addition, when the immune system is strongly activated by a post-traumatic stress situation, and I put here, I posit any situation viewed as chronic and severe stress. That could be divorce, loss of financial support, food scarcity, which we're seeing more and more as things change with the economy and people's dollars aren't purchasing the same amount of resources for themselves. So just again, widen that thought. And then glial cells and other brain immune cells change form and secrete high levels of inflammatory cytokines and prostaglandins, which are involved in the inflammation. So this is again about widening our thinking. I won't go into mine. We can talk about that. We can talk that later. But for you, model the behavior you want to see in your patients. If you've got a history of trauma or emotional imbalance that hasn't been dealt with, take the lead and work on your own issues with regard to chronic stress and trauma, because you're going to then see how neuroinflammation is decreased. You're going to see what nutritionally works. You're going to see what dietarily works. You're going to see what emotionally works. And obviously, maintaining spiritual connection and community is key. That goes back to that study with a child who experiences a strong trauma but then has no family support around them, versus what happened with children that had strong family support. I think the example they used was the child getting bit by a dog, and the differences between if they were supported and non-supported. And then again, listening to your patient's story, make sure you know it and you listen. I often find, and this is where I sometimes get kind of screwed up too, is we get so quick into solving the problem that we're not listening to what the patient's saying. And the most valuable 30 to 45 minutes I'm ever going to have with my patient is that first visit. And you don't get to do it over later, because once you start to interact and you're down in the problem solving mode, you rarely come back and reevaluate the original problem. So make sure that that initial visit with your patient is so clear that you can actually, and what I do with my patients is I actually come back and go, let me make sure I got this right. What I'm hearing is this is your story. And then I go through the whole thing. And sometimes it takes a while, sometimes it doesn't fit into 45. So sometimes I have to, and sometimes I have to come back a second time and go, hey, we didn't finish this, but let's pick this up. I want to make sure I fully understand where you are. And then lastly, on this slide, trauma is individual and unique to each person's personality, life experiences, environment, and some might even say genetics. Trauma is subjective. Don't look at trauma as our named events only. And by saying that, I don't want to minimize the named events, physical abuse, sexual abuse, criminal activity, military stress. I don't want to minimize any of that, but I want to have us widen to think about other forms of trauma that are more chronic and long-standing in nature. Let's see. The only thing I'm going to cover here, just so I can keep moving, is the two-hit hypothesis, really important to understand the two-hit hypothesis. And what that says is in early life, if the microglia are primed by a stressor, whether we'll just call it trauma in general right now, but again, these are chronic stressors that are around for a while. There is a increased incidence of subsequent stress and mental health problems in adult if re-triggered. So it's kind of this, they call it the two-hit hypothesis, which means that the microglia are primed by childhood trauma, and then they're more easily activated by a trauma or a stressor in adulthood. What's interesting is there's also information that shows that with regard to neuroinflammation and trauma and the immune system, that it's a two-hit, it's both ways. So you have a trauma in childhood, and you are more prevalently going to be traumatized as an adult and have mental health issues, but your immune system is also activated. So it tends to lead to a weakening of the immune system as an adult. So think of all your autoimmune conditions that show up. Somebody suddenly develops a lupus diagnosis, or an RA diagnosis, or a psoriatic arthritis diagnosis, and it's diagnosed as an adult. We want to come back and think about, is it possible that what triggered that it wasn't just a genetic autoimmune thing, but it was triggered by a stressor that was potentiated when that person was a child? So again, we come back to getting the full history on the patient, right? Did they have childhood trauma? And we'll talk about how to kind of come to that. I'm just going to read through these real quick just to make sure. Okay, we're going to. And I'm happy to share these slides with you guys, so that's not a problem too. Two-way street, here it is. This is what I was talking about. Immune challenges prenatally. So this is a mom that's stressed prenatally, potentiated, and this is in the child, so this is in the womb. Immune challenges prenatally potentiated responses to stress in adulthood, and stress prenatally potentiated immune system reactivity in adulthood. Either first hit caused microglial priming. Let's see, okay. So this is neuroinflammation inducing of anxiety and depressive-like behavior by modulating neuronal plasticity in the basolateral amygdala. So the amygdala, the emotional center, the reptilian brain, the earliest part of our brain development. So this is where we think of things like instinctual reactions to stressors. And what they did, and this was also a rat study, what they did was they injected rats with lipopolysaccharide, which is basically just an inflammatory sugar, and that created systemic inflammation. And what they found was it led to activation of the microglia, we already know that, but then it produced these pro-inflammatory cytokines that were specifically located in the amygdala. So the emotional center of the brain, which is why it ties to trauma specifically, because we're getting to the instinctual, how we react to a traumatic experience. Again, let's widen our thought of trauma to also look at chronic long-term expression of stress. Let's see. Okay, dysregulation of the amygdala projection neurons can contribute to psychiatric disorders and may account for neuroinflammation-induced anxiety and depressive-like behavior. So when you start seeing, which I don't know about you guys, but I'm seeing more and more anxiety diagnoses coming into my office every day. It's literally a pandemic, and a true pandemic. We have to start looking at what's going on with the emotional part of the brain and what's going on with neuroinflammation. That's why I'm so excited about neuroregenics, because we have a tool now to actually, again, we're not practicing psychiatry or psychology or whatever, but we have a tool that we can help people with these chronic anxiety conditions, depressive conditions that we didn't have before. So this is down here, trauma changes our brain on PET scan and functional MRI imaging. So they've been doing this for years, but you actually see demonstrated changes to brain function and morphology on both of those things. This is the thymus study. Chase, did you talk about the thymus study at all?
I saw your slides, so I
Okay.
pushed it to later.
Okay, so, but you have a little bit on it in your, okay. So this, you guys, this study was what, 23 pages?
Yeah.
I mean, I'll tell you, like, I'm definitely not I'm not a Mensa member, but this thing was hard to get through. But I'm going to try to simplify it because it's super powerful. What they did was they took rats, they did it's a cortical something impact. I forgot what anyway, they basically like took something and shocked the rats, an actually impact hammer or something like that. And then what they did was they supplemented the rats with glandular thymus, which we don't have a pure glandular thymus product, do we, in standard processes line? Thymex is the cytoplasmic, and then thymus PMG. Yeah, which has does it have full glandular or just the nuclear fraction? I think it just has a nuclear fraction, right? Who said that?
I think so.
Yeah, is it just, I think it's just is it the full glandular in thymus?
I don't have the answer.
Yeah, I don't either. It's not, right? I think it's the nuclear fraction. So that's okay. Actually, we got the best product, so it doesn't matter. But what they did was they took they took those three things and they basically gave a powdered substance of entire thymus glandular, thymex, and thymus PMG to these rats. And what they found was only the thymus PMG modulated signaling pathways in the hippocampus, including those involved in cell cleanup. The cytoplasmic extract or desiccated glandular did not do that. So that doesn't mean Thymex is not a great product, but for our thoughts about neuroinflammation, thymus PMG is your go-to for sure. The rats had greatly improved balance and spatial memory tests only with the thymus PMG and the desiccated thymus. The Thymex itself did not improve balance and spatial. They had them walk on the rats. I don't know how they got them to do it. They had them walk on a balance beam, which I'm like, how do you entice a rat to walk on a balance beam? But anyway, that's what they did. The bone-derived thymus extracts contain antigens found in neural tissues. So the thymus itself has a neuroectodermal connection, right? Which is really, really powerful because it's connected directly to the brain in some ways, right? We know the thymus has to do with self, right? Differentiating self and non-self, which is why it's also involved in autoimmune, all your autoimmune conditions. Like thymus PMG would be a great support for any autoimmune condition. There's a technique, I want to say it's TBM, where you do what's called a thymus tap, right? Where you just tap your thymus and you can do self-referential statements. That's wonderful. Like, I am getting healthier day by day. I am getting, and you tap over the thymus. So great for the immune system. Let's see. Okay. Thymus PMG and desiccated thymus, which is the glandular, improved 50 signaling pathways related to the immune system response, inflammation, and tissue repair, but only thymus PMG significantly improved the animal's recovery. So definitely thymus PMG is the one you want to go to if you're thinking neuroinflammation. Okay, I'm going to skip this. Chase may cover some of this that he's going to talk about in his case study. I'll just let you read that for a second there. Okay, this, please don't email this person. I forgot to blank out. I cut off the top, but then I realized I didn't get rid of so I got this in my email yesterday. And my point about this is, if you look down here, childhood, they're offering in my area for people to become part of a clinical trial to psychiatry practice, 4 and 5-year-olds being tested. We can do better than that.
What is it?
They're testing a new pharmaceutical for 4 and 5-year-olds for ADD and ADHD. We have a tool, Neuroregenics. So my thought when she said cradle to grave, I'm like, yeah, 4 and 5. But if we're doing this at 4 and 5, we can certainly use Neuroregenics. Okay, I mean, this So anyway, again, don't attack. Don't use the email. Anyway, just this is really interesting. This was a side note in the thymus article. What they also found was the nuclear fraction of bovine heart, so cardiotrophin. They used cardiotrophin could elicit the production of the IgG antibodies against nervous system proteins, similar to what the thymus cytosol factor did, and similar to Thymex and thymus PMG. Thymex and thymus PMG both had some effect in that area. So all I'm saying is it's kind of interesting that cardiotrophin created some of the same things that thymus PMG did with regard to limiting and controlling neuroinflammation. So I just put this down here. I don't know. It's really interesting to think about. If we have someone who has neuroinflammation, but their neuroinflammation is also related to another organ dysfunction, like they've got horrible liver enzymes or they've got horrible if we chose the PMG of the related organ that's happening at the same time, might there be a connection? They didn't answer the question in this study, but it's super interesting to think about. So my point was maybe the brain and all our organs, including our heart, are more connected than we will ever understand. Could this indicate that whenever an organ is injured, that the brain and the organ should both be supported equally and quickly? So we'll skip that. This is just saying that the thymus is neuroectodermal tissue. Regulation of the immune system between self and non-self. It displays a neuroprotective and anti-inflammatory properties. The myeloid cells are developed from bone marrow, which again then are able to cross the blood-brain barrier. Think of thymus function in all autoimmune diseases and neuroinflammation. So here's what I wanted to get to. What can you start doing Monday in your office? Neuroinflammation control nutritionally. You have to start there. So Neuroregenics, Olaprima, tuna omega oil, neurotrophin, hypothalamus PMG, hypothalamics, and I muscle test all this stuff, so we can talk about, if we have a little bit of time afterwards, I'm happy to sit around and chat about how you would differentiate and maybe choose just based on other things. Systemic inflammation control, you can't just control neuroinflammation if there's systemic inflammation. So if there's gut inflammation, you've got to look at that. If there's liver inflammation, you've got to look at that. If there's mold exposure, you've got to look at that. And sears, I'm seeing more mold and sears patients in my office all the time. And frankly, not everybody can do the shoemaker protocol with shoemaker, so in his office. So, we got.
What's sears?
Oh, chronic inflammatory something syndrome. It's basically a progression of mold exposure where you develop chronic inflammatory symptoms all over the body, including neuroinflammation. So in Houston, the level of mold we have here, in any mold case, you've got to start thinking neuroregenics now as a neuroinflammation tool. Emotional balancing and release techniques to get at subconscious unresolved emotional issues, neuroinflammatory pathways that have what we call subs. In NET, we call that some unfinished business. So when you hear a patient come in and they're repeating something that hasn't, right? They're repeating a trauma or something that's happened in their life. We call that some unfinished business. They need to do some type of work on that, whether it be NET, EMDR, acupuncture, which gets at some of the emotional and energetic pathways, all that kind of stuff. Aerobic exercise, we talked about zone 1 to 3 in heart rate. If you get into 4 and 5, you're no longer aerobic. Mindfulness and stress lowering techniques, sleep hygiene, important digestive inflammation becomes systemic inflammation, which becomes neuroinflammation via inflammatory response pathways. And this process is a two-way street, or as Mayer says in his book, The Mind-Gut Connection, he says it's a 2-lane road from brain to gut. It's a 9-lane superhighway from gut to brain. So we used to just go, it's a 2-lane road, 1 lane this way, 1 lane this way. His book, based on research, supports that because of the number of cells in our microbiome, billions and billions of cells, which Patrick Krupko talked about at our last seminar, it's a 9-lane superhighway going gut to brain, which again pulls us back to We're dealing with neuroinflammation, but we're also dealing most often with gut inflammation as well. We'll skip this. This is just something on brain inflammation and depression and how that works. So considerations. Pottinger's cat. If you've ever read Pottinger's cat, has everybody read Pottinger's cats? Okay, so I'm not going to repeat that. If you haven't read it, I'm happy to. I love talking about it because it was done in the 30s and 40s. It's as true today as it was back then. The key with Pottinger's cats is he said in the 3rd to 4th generation of those cats that the mother cats started eating their young, which is not typical cat behavior. And the extrapolation from that is in the 3rd to 4th generation from the 1930s and 40s, we would start to see an increase in the human population of anxiety, abnormal behavior, mental health challenges. That's where we are right now, right? A generation, let's say it's 25 years, we're getting really close to 4th generation. IFM core food plan, I have that. I'm not going to pull it up here. I can show that to you, but any other elimination diet that's anti-inflammatory would be super helpful. You guys probably have stuff in your office. I'm happy to share what IFM puts out there as their core food plan, which is basically just a whole food, low inflammation food plan. Digestive stool analysis, looking at GI inflammation because it becomes neuroinflammation. I'll talk more about that in the case study. There's some blood labs, that's just basics. There's a whole bunch of other stuff there if there's other involvements. Neurotransmitter and organic acid testing. And then nutritional, you can do your nutritional assessment. There's lots of ways to do it. I use muscle testing, I use functional lab testing. I've done symptom surveys. I've kind of used it all over the years. So they're all good and they all do different things. So it's not one size fits all. Those are sort of some of my key supplements that I use. And again, I can explain later why those are on that list there. Emotional, identifying.
You're fine.
Okay.
Yeah. Do you want like 10 more minutes?
Yeah, maybe 10 minutes. Yeah, sorry. I overdid here. Sorry, guys. But again, I'm happy to share this. And you guys have got my contact information. If there's anything I didn't explain completely, I love talking shop. Yeah.
Chrissy, the other again is both your PowerPoints.
Well,
Yeah, so they're both going to email all of you their.
okay.
PowerPoints.
Perfect. Great. Yeah.
Yeah.
Okay. So that's the nutritional side, right? Which is mainly what we're talking about here. And so this is the emotional consideration. Identify patients and patients types that need neuroinflammation. This is not an exhaustive list, but it's a big list. I mean, almost every patient that comes into my office has something akin to one of these things. Not all, but almost. If you aren't using an adverse childhood event questionnaire, that's what that link was supposed to be. I'm not going to pull it up because I don't want to take the time. I have one from IFM. I actually have 2. Happy to send it to you. If you're not using something like that to access what's going on in your patient's history with regard to trauma or adverse childhood events, there is such a correlation between that and neuroinflammation, depression, anxiety, and adult mental health issues. To me, it's got to be part of what we look at. And then there's an HPA axis questionnaire that specifically isolates the hypothalamus, pituitary, and adrenal axis. If you don't do emotional work, how many people do emotional work some sort in their office? So we've got a couple. No problem if you don't, because we got plenty of work to do on the nutritional side. But here's the thing. If there were a couple people that raised their hand. I'm in the Woodlands. Where are you located? Cypress. Where are you located?
North Houston.
North Houston. So there's a few of us around. Paula Howell is not here. I know Paul and Shane do some emotional work. Refer to somebody, like, here's the thing. We've got so many patients out there. We are not in competition with each other. We are in this together, which is why I was so excited to come do this, because we are healing people that are in desperate need. So if you don't do emotional work, get your patient to somebody who does that's in our community. There's a couple people that raised their hand here. I do NET. I'm going to send your patient right back to you. I will not let them stay in my office because you're already doing the nutritional work. I am not going to become the cook in the kitchen with you. I am going to send that person back to you, but I'm hoping you'll get better results with your patients because we're looking at this piece. So attunement, EMDR, acupuncture, mind-body healing techniques. If the person wants to take more of a self-directed approach, EFT, tapping, journaling, mindfulness and spiritual practices. Mind-based only therapies in all the research do not do the trick alone. So counseling by itself does not solve the neuroinflammation problem. It has to be a top-down and a bottom-up approach. So top-down is higher brain centers like counseling, intellectual stuff, journaling, and working your way down through the cortex, neocortex, hippocampus, amygdala, and hypothalamus. Bottom-up is massage, breath work, vagal theory, vagal exercises, chiropractic, I believe works both ways, bottom up and top down and bottom up. Building community and connection is a must. Isolation is the twin devil to trauma. So if you have somebody coming in and they're isolated, they have to build community somehow. This is 5-element theory. I'm not going to have time to talk about that, but the acupuncturists in the room know this. But I just want you to notice one thing. Parasympathetic brain and nervous system is here. Look at what it's between. Liver and digestive system. So, right, we know neuroinflammation has a huge root in liver function, liver inflammation, and digestive function. So I just wanted you to see that. And usually, actually, most of the time you see this fire, the fire element is typically on the top as the top piece because it relates to the nervous system and brain. This is the NET chart. It's really interesting. This is publicly available, so I'm not doing anything, and I'm not training NET, but you can see some correlations with emotions and the meridian system. So if you're seeing a patient that comes in, they're chronically angry, someone who has a gallbladder problem, and like I think of my patient Janet many years ago, I'm like, Janet, I think you have a gallbladder problem. I don't have a gallbladder problem. I've had people tell me that over and over again. Like literally I was in this circle because I'm talking to her about her gallbladder. She's angry and resentful that I'm bringing up her gallbladder. She ended up having a gallbladder surgery, almost died at MD Anderson of pancreatitis. She still after that would not admit that she had a gallbladder problem. It was a pancreatitis that caused it. So aerobic exercise, if we have just a minute, actually I'll do it after. I would like to take everybody through this vagal nerve exercise because it's really simple and it's fun. So if we have a moment after, we can go through those 3 things. Really simple to basic reset of the vagus nerve. Box breathing, which is just simply a 4-second inhale, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. I personally like 4-7-8 breathing better. I find that it's more of a reset for the autonomic nervous system and the vagus nerve, but those are both there as well. We have all this kind of stuff going on. I think we're eventually going to have some research. None of this is being done in the US. I have patients right now that are taking kibbutzes down to Peru and Argentina and doing all kinds of guided ayahuasca and San Pedro things, and there are some people studying it that believe there's some preliminary things that are showing that neuroplasticity is highly increased by doing these kind of guided experiences. So, of course, research is happening outside of the United States because we have prescription drugs and ketamine, and we don't have nutritional support. So, not that ketamine, there are some actual positive studies on ketamine and trauma as well. So I don't want to push that down. It's just that we're not digging into other things that could also be used. We're gonna skip the video.
It doesn't work?
No, it'll work.
How long is it?
It's about 3 minutes.
Yeah, we've got time.
Welcome back. This is Dr. James Sung. We're at Clinical Excellence.
This guy's kind of funny.
It's excellent results. The last several weeks, we've been talking about neuroinflammation and how different environmental triggers, food and so forth, affects inflammation of the brain. Today, I'm going to go ahead and summarize.
Actually, you know what? I think it's going to be
If you want more detail about each individual subject, you can go back.
I think we'll can you, let's see, can we get out of this? We'll save that. That's going to be, I think it's going to be too long. Anyway, you can, if you want to, you can just look. It's just a good overview of, thanks, Chase, appreciate that. It's a good overview of kind of everything we've been talking about. So if you want to watch that, it's kind of, yeah, I think he's either a neurosurgeon or a neurologist. So Okay, let me just go back here. I think,
I don't know how to do this on your computer, so you can go maybe.
there we go. I think it's going. Yeah, okay. So again, this is just a small picture of neuroinflammation, but start thinking outside the box. Autism, ADD, ADHD, insomnia, dementia. I mean, there's so much here, guys. I mean, when I started thinking about it and looking at what I'm doing, I almost had this feeling of like, I should pretty much have every patient on thymus PMG and neurogenics. And it's not because I'm doing this particular talk, but just because the effects are so wide ranging. So, gosh, it's just amazing. So anyway, these are our 4 ingredients. We already talked about this. Christy talked a little bit about it, but the only thing I wanted to add is that turmeric is also a free radical scavenger. So it helps with oxidative stress as well. And it's a strong natural COX-2 inhibitor. So in addition to your neuroinflammation, you also get the benefit of like joint inflammation, help with joint inflammation, osteoarthritis, spinal degeneration issues, that kind of stuff. It is contraindicated in patients with high blood pressure. Boswellia prevents the formation of leukotrienes, which are inflammatory mediators, which are produced by leukocytes by the oxidation of arachidonic acid and eicosapentaenoic acid. I can never say that. I just say EPA because it's so brutal to say that. And Boswellia, in addition, remember, same thing with turmeric, decreases inflammation in the bowel. So again, the fact that it's in neuroregenics, it's a neuroinflammatory tool, but it's also reducing inflammation in the gut. I knew very little about Gotical. I'm going to be honest. I was like, I don't really know much about this, but when it came out in neurogenics, I started looking at it and look at the effects here. It's used all over the world in non-US for Alzheimer's, natural treatment for Alzheimer's, enhanced cognition and memory, reduced anxiety and stress, antidepressant-like effects, improves circulation and wound healing, which is really important because otherwise, I put here, otherwise known as completing the inflammatory process. If you increase circulation, you help the inflammatory cascade happen faster. It's going to happen, but we want it to extinguish faster. Can increase blood sugars, so just be careful of that if you have somebody that's blood sugar sensitive, and can have a sedative effect. So if somebody starts feeling real calm and whatever, just let them know that that might be part of the thing. Liver cleanser, increased immunity, decreased inflammation. It helps boost mood, right? So we know with neuroinflammation, we've got all these mood issues, anxiety, stress, depression, all that is there. And then the only other thing I wanted to share, which is just, again, the intelligence is built in here with Standard Process. I've been with Standard Process since '97. I've been using their products. So there's calcium in there. I was looking at the label like, why the hell is calcium? I mean, like, did they just throw that in as a binder? Like, what the heck's going on here? Look at the study. Dr. Longden and a research team, and I forgot where this was done, dissected the intricate cellular mechanism behind calcium's role in directing blood branch by branch to the tiny vessels of the brain. They found that when neurons fire electrical signals, they cause an increase in calcium in the cells lining the blood vessels. The enzymes detect this calcium, direct the cells to make nitric oxide. Nitric oxide is a hormone and a gas that causes muscle-like cells around blood vessels to relax, thus increasing blood flow to the area. So capillaries were traditionally thought of as simple conduits of red blood cells and the barrier between the blood and the brain. Here we revealed as an unknown universe of calcium signaling in capillaries, and much like traffic lights, these calcium signals direct vital nutrients to nearby active neurons. So is it possible that our calcium also helps direct our blood flow to repair neuroinflammation? Absolutely. So that is my presentation sorry I had to skip through some stuff. I'll have a better idea. It's been a while. I used to teach quite a bit at chiropractic college, and then a couple of massage schools and some community colleges back in the day, but it's been a hot minute since I've been able to teach outside of my office. So anyway, I think that is it. And then the case studies for down the road. So I think, Chase, are we gonna go with or where are we going next? Are we taking a break?
Yeah, so